My first pathogen is poliomyelitis. As you can see in figure 1, that is the virus itself. The causative pathogen for poliomyelitis is the poliovirus homines. Um, there is a serotype of the species enterovirus. There are three types, 1, 2, and 3. Most outbreaks are due to type 1. It is in the family of Picanorviridae, which is a related non-enveloped RNA viruses which infect vertebrates, including mammals and birds. They are viruses that represent a large family of small positive sense single-strand RNA viruses with a 30 nanometer protein capsid. This virus is also very stable in external environments and is resistant to low temperatures and disinfectants. As you can see in figure 2, that is the polio virus. And again, it is composed of a capsid that is made out of protein. It is 30 nanometers in diameter, and inside the capsid is a single strand molecule of RNA, which is the information to make the new virus. Continuing with causative pathogen, the poliovirus um, is an obligate intercellular parasite which has been classified into three main types. So you have the Brunhide, named after the rhesus monkey in which the virus was first identified. You have Lancing, which is isolated from a fatal case of bull bear polio in Lansing, Michigan. And you have the Leon, identified in a child named Leon during the Los Angeles epidemic. And in figure 3, you can see the polio virus is bound to the neuron receptor. Again, that does poliovirus can lead to paralytic or paralysis. Some symptoms, we have non-paralytic polio, which you get flu-like symptoms such as sore throat, fever, tiredness, nausea, headache, stomach pain, and you can also just be asymptomatic, not show any symptoms at all. These symptoms usually last 2 to 5 days and then go away on their own. And then you have the paralytic polio, which is more severe with paresthesis, which is just feeling of pins and needles in your legs, meningitis, which is infection of the covering of the spinal cord and brain, occurs in about 1 out of 25 people with poliovirus infection. And then you have paralysis. Which occurs in about 1 out of 200 people with the poliovirus infection. AFP is just a clinical syndrome, which refers to a collection of signs and symptoms instead of an actual diagnosis. It is defined by the acute onset of weakness or paralysis with reduced muscle tone in children. Um, Paralysis is most severe symptom associated with polio because it can lead to permanent disability and death. Between 2 out of 10, 2 and 10 out of 100 people who have paralysis from polio infection die because the virus affects the muscles that help them breathe. And then transmission, the mode of transmission is mostly fecal oral route, so feces or through the mouth, and also droplet infections. Infectious material such as feces and or the oral pharyngeal secretions of an infected person. The period of communicability is 7 to 10 days before and after onset of symptoms. In feces, the virus can last up to 2 to 3 weeks, sometimes even longer, such as 3 to 4 months. And then the incubation period is 7 to 14 days. And then you can see in this figure, it's just the shows you the spread cycle of polio. Treatments. So there are preventative treatments, which are the immunizations, which is the most effective method of controlling polio. We have two types. We have inactive polio vaccine, which is the first 3 doses given at intervals of 1 to 2 months, and the fourth dose 6 to 12 months after the third dose. The doses at each age is usually 2 months, 4 months, 6 through 18 months, and 4 to 6 years old. And then we have the oral polio vaccine, um, which is no longer licensed or available in the United States. It is still used in some parts of the world, and children do receive doses of vaccines by drops in the mouth. And then treatment for infected persons. Because no cure for polio exists, all we can do is increase your comfort and speed up the recovery and prevent complications, such as just doing pain relievers, portable ventilators to assist with breathing, and moderate exercises such as physical therapy to prevent deformity and loss of muscle function. So we do have some history, but I'm just going to give a few. The first major documented polio outbreak in the United States occurred in 1894, and then the first vaccine was developed by Salk, which was declared safe and effective in 1955. And then we also just have a couple more of the history. And last reported case in India was on January 13th of 2011. So still pretty recent, but that is the last reported case. So just some questions. What did you find most interesting about polio, and what is the treatment if infected with the virus? What's the treatment for that? And then our next pathogen is the African sleeping sickness. As you can see here, these are the parasites in a blood smear. So, African trypanosomiasis, also known as sleeping sickness, is caused by microscopic parasites of the species Trypanosoma brucei. There are two morphologically indistinguishable subspecies of the parasite that cause distinct disease patterns in humans. So we have TB gabions, which is found in 24 countries in West and Central Africa. This form currently accounts for 98% of the reported cases and causes a chronic infection. And then we have TB um, rhodesiense, which is found in 13 countries in Eastern and Southern Africa. Not as current as the Gambians, but this disease is rapid and invades the central nervous system. So we do have some symptoms, which include fever, severe headaches, irritability, extreme fatigue, swollen lymph nodes, and aching muscle and joints. Some people develop a skin rash around the area that they were bit. Um, Also, there are some neurological problems that can cause confusion and personality changes if invading the central nervous system. And then symptoms usually within 1 to 3 weeks after an infective bite. If left untreated, infectious becomes worse and death will occur within months. Transmission. So the transmitted is through the tsetse fly, which is found only in sub-Saharan Africa. The tsetse flies inhabit rural areas, living in the woodlands and thickets that are in East African savanna. In Central and West Africa, they live in forests and vegetation along streams. Tsetse flies bite during the daylight hours. Both male and female can transmit the infection. But it is a small percentage of flies that are infected now. Treatment. Only 4 drugs are registered for the treatment of human African sleep sickness, which includes the pitandine, ceramine, milosoprol, and eflornithine. And in the figure, you can see this just shows you the medications, doses for each drug, and stage. Um, for pentamidine is used for the first or early stages of TB gambians and TB rhodesians infections, respectively, and available in the United States. So, some preventions, there are no vaccines to prevent African sleeping sickness, but you can avoid being bit by tsetse flies, which they recommend for you to use wear protective clothing such as long sleeve shirts, wear khaki and neutral colored clothing because CC flies are attracted to bright and dark contrasts of color. Use bed nets when sleeping so you don't get bit at night. And then you also want to make sure that you don't ride on the back of Jeeps because flies are attracted to the dust created by moving vehicles. You also want to stay away from bushes, during the hot part of the day. The tsetse flies like to rest there, and they will bite if disturbed. And then a couple, history of sleeping sickness includes just 900 cases of TB Gambian's strain is diagnosed in 2019, which is less than in 1998, which was 38,000. Historically, deadly epidemics are followed periods where disease seemed controlled, and the tsetse flies are present in 36 of the African countries. And then I'm just going to point out that 62% of sleeping sickness cases in 2018 were reported in DRC. And questions that I have are, what type of clothes should you wear to prevent getting bit? And what kind of pathogen caused African sleeping sickness?